video is designed to give you an overview of the ski sheet and is not intended to be a substitute for actual training with the product. The video needs to be assessed in line with the manual handling and cross-infection policies in place within your organisation. Please bear in mind that although the video has been filmed within an NHS hospital, the equipment has been designed for use in various types of buildings where the available space is often very limited. Any manual handling techniques used within the video are merely suggested methods to move non-ambulant persons in an emergency. It is noted that there may be other acceptable alternative techniques on some occasions depending upon the physical and mental condition of the patient or resident, and within slightly different environments to those portrayed. As detailed on the label, the ski sheet has been safe load tested to a maximum weight of 160 kilograms, although the maximum load to be pulled downstairs should be recommended by your manual handling advisors. It is suggested that a minimum of 2 people handle the ski sheet and mattress. As a general rule, the maximum weight being pulled should not be more than the combined weight of the handlers. Each patient will have his or her own manual handling plan, and this should be considered before transferring any patient using this equipment. Lay the ski sheet on the base of the bed with the white label facing up. Concertina the belts and store in the easily accessible pockets in the corner sides of the ski sheet. Attach the ski sheet to the mattress using the elastic corner loops and adjust for a snug fit, ensuring that the elastic is not twisted. The bed is then made up in the normal way with the ski sheet unobtrusively but securely fixed to the underside of the mattress. Tuck in the end pulling handles so that they are not protruding from the underside of the mattress. If time allows, always work with the bed at a comfortable height. To prepare the patient for evacuation, wrap her in the bedding. This will ensure that she is kept warm, and it also adds extra protection. Place the spare pillows across the chest, legs and one under the head if enough are available. Working in pairs, remove the cross straps from the corner pockets and tighten. They should be comfortable for the patient, but tight enough to form a U shape with the mattress. This will cocoon the patient, reduce the mattress friction when pulling, and prevent the patient from sliding. Remove the pulling handles from the head and foot end of the bed. Various methods of taking the patient off the bed can be used. Please consult your moving and handling department to ascertain the correct method of transfer for your own specific environment. If the type of bed and space allows, the bed can be tilted towards the foot end. Remove the foot end of the bed, lower and tilt the bed.
Okay, that's fine.
Okay, Phil.
Okay then, yeah.
Ready, Linda? Okay.
The patient is then pulled off the foot end of the bed. Make sure to protect the patient's head throughout this procedure, particularly as the head comes off the end of the bed. Take hold of the pulling straps and move the patient into a position where the mattress is clear of the bed frame. The person at the head end starts to move backwards, allowing the ski sheet and mattress to touch the floor. The foot end operator allows the straps to move through their hands, controlling the descent of the ski sheet onto the floor. Once the ski sheet and mattress are on the floor, both operators should pull it from the same end. If doors are to be negotiated, it should be pulled from the head end to avoid the doors closing on the patient's head. However, it is vital that the patient approaches the stairs feet first, so be careful to ensure that turning the ski sheet and mattress around in a narrow corridor is not required to achieve this feet first position. With one person at each end of the ski sheet, the patient can be moved down the stairs. It is very important that the person at the foot end keeps the pulling strap short until the upper part of the body has come over the top step. This helps to prevent excessive bending of the patient's hip and pelvic area. The operator at the head end should keep the pulling strap long and assist by slightly raising the handle as the body moves over the top step. When reaching a half landing, it is important to steer a wide course so you do not encounter problems with the central pillar of the staircase. The foot end operator controls the speed of descent. Good communication is essential to ensure that the carer at the head end does not overbalance in an attempt to keep pace with the carer at the lower end. Once the patient has exited the building and reached a point of safety, the cross straps can be loosened to ensure that the patient is comfortable. When laundering does become necessary, usually with every change of bed occupant, the buckles on the belts should be fastened and a temperature of up to 80 degrees centigrade can be used. To protect the buckles, it is recommended that the sheets should be washed in a wash bag which are available from the manufacturer. Thorough rinsing will ensure that no detergent deposit is left. A disinfectant may be added to the final rinse if required. When drying, a low temperature is recommended to prevent the nylon material from becoming brittle and shrinking. If you have any questions or would like to request more information on the ski sheet or the wash bag, please contact Hospital Aids.